Monkey look in mirror and see forehead getting bigger like expanding jungle clearing. What used to be thick hairline now looks like retreating army leaving battlefield. But monkey learn receding hairline different beast than crown balding. Requires specific battle strategy. Not generic hair loss advice that internet parrots keep repeating. Today, monkey share targeted approach backed by science to bring hairline forward, like advancing guerrilla battalion. First, understand enemy. Why hairline retreat? First, hairline follicles most sensitive to DHT hormone because they have highest concentration of androgen receptors, like having bullseye painted on forehead for DHT attacks. These follicles also have thinner skin coverage and less blood supply than crown area. Double vulnerability like baby monkey walking into lion den. Temple recession follows predictable pattern called Norwood scale. Starts with small triangular areas, then spreads inward creating M shape, eventually connecting to crown if left untreated. Understanding your Norwood stage helps determine realistic expectations and treatment intensity needed. Most monkey notice hairline changes around age 25 to 30, but some unlucky genetic lottery winners see changes in late teens. Earlier intervention always better. Easier to defend existing hair than resurrect dead follicles. Step 1. Block DHT at the source. Finasteride reduces DHT by 70% throughout scalp, but hairline needs extra firepower because follicles there are so sensitive. Studies show finasteride stops further recession in 86% of monkey. Actual regrowth happens in about 48%, lower success rate than crown area but still significant. Dutasteride blocks 90% of DHT and shows better hairline results in head-to-head studies. More powerful but also more side effect risk. Start with finasteride, escalate to dutasteride if results disappointing after 12 months. Topical finasteride option for monkey worried about systemic effects. Gets concentrated at hairline with potentially fewer body-wide effects. Some compounding pharmacies make custom concentrations, though absorption varies between monkey scalp types. Step 2. Stimulate blood flow to starving follicles. Minoxidil, especially important for hairline because area has naturally poor circulation. 5% concentration minimum. 2% like bringing water pistol to forest fire. Apply twice daily focusing on actual hairline, not just general forehead area. Minoxidil with tretinoin combination increases absorption by making skin more permeable. Tretinoin also has independent hair growth benefits through vitamin A pathway. Some monkey get initial irritation but skin adapts after few weeks. Derma rolling 1.5 millimeters once weekly along hairline creates tiny wounds that trigger healing response and growth factors. Study showed 4 times better results when combined with minoxidil. Roll perpendicular to hairline direction to avoid damaging existing hairs. Daily scalp massage focusing on temple areas increases blood flow and may help preserve remaining follicles. Use fingertips with moderate pressure for 2 to 3 minutes, like giving scalp gentle workout. Step 3. Advanced hairline tactics. RU 58841 research compound blocks androgen receptors directly at follicle level. Stronger than topical finasteride, but unregulated quality control buying from underground monkey chemists carries risk. Some brave monkey report excellent hairline results, but long-term safety unknown. Microneedling with growth factor serums. Tiny needles create channels for better serum penetration while triggering natural healing response. Professional treatments more effective than home rollers, but also more expensive, like hiring personal trainer versus doing push-ups alone. Topical caffeine solutions may help by blocking adenosine receptors and improving circulation. Weaker than proven treatments, but good addition to main arsenal like having backup banana when primary banana goes bad. Realistic timeline and expectations. Hairline responds slower than crown because follicles more damaged and blood supply weaker. Expect 6 to 12 months before seeing meaningful regrowth versus 3 to 6 months for crown area. Early intervention most successful. Norwood 1 to 2 often see good regrowth. Norwood 3 to 4 see stabilization with modest gains. Norwood 5 plus unlikely to see significant natural regrowth without transplant backup. Baby hairs appear first as thin, light-colored strands before thickening into terminal hairs. Many monkey get discouraged and quit during this awkward phase, like judging banana tree by first tiny green buds instead of waiting for full fruit. When natural methods reach limits. Hair transplant specifically designed for hairline reconstruction uses single hair grafts to recreate natural irregular pattern. Skilled surgeon can lower hairline 1 to 2 centimeters while maintaining realistic density. Few e-transplant takes individual follicles from back of head where DHT can't reach them. These transplanted hairs keep their DHT-resistant genetics even in new location, like moving strong monkey warriors to weak defensive position. Cost ranges $5,000 to $15,000. depending on how much hairline needs rebuilding. Results permanent but requires continued medical treatment to prevent further recession behind transplanted area. Common monkey mistakes ruining hairline recovery: expecting overnight results when follicles work on geological timescale. Inconsistent treatment application: skipping days kills momentum like stopping banana tree watering during dry season. Using too aggressive derma rolling technique that damages existing hairs instead of helping them. Trying unproven treatments first while hairline continues retreating, like rearranging deck chairs while ship sinking. Focusing only on regrowth while ignoring prevention. New baby hairs useless if DHT still attacking them daily. Track hairline progress properly. Use HairBuddy app with standardized front-facing photos from same distance and lighting. Monthly photos better than daily mirror obsessing that drives monkey crazy with imaginary changes. Quick recap. Hairline recession needs targeted approach because follicles there most DHT sensitive with poorest blood supply. Block DHT with finasteride or dutasteride. Stimulate circulation with minoxidil and derma rolling. Advanced options include RU58841 and growth factor treatments. Expect 6 to 12 months for results. Consider transplant when natural limits reached. Track progress with photos and measurements, not mirror anxiety. Remember, even receded hairline still handsome monkey face, just with more forehead real estate for bigger brain display.